It's time again for Health Monitor, the #1 program that's so to help to live a life in its healthiest way, to improve the quality of health and life and inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, your guide to good health. It's Health Monitor, the #1 health show.
It is time for Health Monitor once again, and I want to welcome very specially to the show. Today's show is explosive, okay? We have our regulars in the house, and they'll be talking to you on various health issues to keep your health in top shape. My name is Jibe Odloge, and welcome once again. I want to take a break, and when I come back, the show will continue. It's Health Monitor, the #1 health show.
It can be pretty annoying when I have to deal with oil and grease in the kitchen, stains in the toilet, dust in my car and office. But the new Fresher Wonder Wipe multi-purpose towel, all of that is in the past. Now, my kitchen utensils are oil and grease free. My toilet is sparkling clean. My car and office, wow. And guess what? I don't have to worry about any other paper wipe and the stains on them. Fresher Wonder Wipe multi-purpose towel is first of its kind. It can be used anywhere and everywhere. It is strong, absorbent, hygienic, and it saves cost because it is washable and reusable. It comes in a normal and heavy-duty sheet for stain removal. Fresher Wonder Wipes multi-purpose towel is available in all leading stores in Nigeria. A quality product from the House of Daraju.
Today I want to look at the nutritional tips that can help you stay healthy before and during pregnancy. If you want to carry your baby to term and also stay in good health, you should eat calcium-rich foods, including low-fat dairy, beans, almonds, and dark green leafy vegetables such as spinach. Then you should avoid refined foods such as white breads, pasta, and sugar. They eat lean meats, cold water, fish, soy, and beans for protein. Then you should use healthy cooking oil such as olive oil or vegetable oil. Then reduce or eliminate trans fatty acids found in commercially baked goods such as cookies, crackers, cakes, French fries, onion rings, donuts, processed foods, and margarine. Then you should drink 6 to 8 glasses of filtered water daily. Then exercise regularly, but talk to your doctor about finding the right exercise program for you. Then caffeine, alcohol, and tobacco raise the risk of miscarriage and should be avoided.
Memories are created daily from events, photo, and video shoots. Having the perfect studio, equipment, and right team is everything. That's why I completely trust Arwell's Media with my event coverage, studio space, equipment, photo, and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. Arwell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Acme Road, Agidingbi, Ikeja, Lagos. Arwell's Media, solving problems, executing visions, and giving value.
Since there are 2 tubes, if a woman has one of the tubes blocked, then there's a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered.
Many women go from one hospital to the other, trying to cure what is not actually a disease.
Good day, you're welcome to the assisted reproduction section of the show. I am Dr. Ive Omori from True Care Fertility Clinic. Today we are going to be talking about pre-implantation genetic diagnosis, which are alternatively use the word PGD for it. Actually means the same thing. What is pre-implantation genetic diagnosis? It is an adjunct to in vitro fertilization. We always talk about IVF on this show, But this now, it's an adjunct, it's done simultaneously with the IVF, and it's a method used to screen for some diseases in the embryo prior to pregnancy occurring, meaning that you can diagnose a disease in an embryo while it's still in the laboratory. And this enables us to avoid so many conditions, so many diseases. Another very important use of pre-implantation genetic diagnosis is in gender discernment or sex discernment, meaning that you can be able to tell the sex of a baby, of an embryo, prior to pregnancy occurring. And this is very important in our environment for family balancing. So what are the advantages of this pre-implantation genetic diagnosis, and how is it done? And some of you will be curious to ask, like, okay, how possible is it? It is very, very possible. And there's some, the advantage is to avoid pregnancy termination in some diseases, which is usually diagnosed after pregnancy has occurred. But in PGD, we can diagnose this disease prior to even pregnancy happening. So there is no issue of pregnancy termination with PGD. So what are the important diseases do we talk about here? There are so many genetically linked diseases. You have the autosomal recessive, autosomal dominant, and the X-linked diseases. So what are the common autosomal recessive diseases in our environment that can be handled with pre-implantation genetic diagnosis? Sickle cell anemia, sickle cell disease, is a common disease in the environment. And most times you see a couple, because two people in love, they can't get married because you hear one is AS, the other is AS as well. So at the end of the day, they are not able to get married. But with PGD, I can tell you now categorically that even when an AS person gets married to someone with AS, you can diagnose the genotype of the baby prior to pregnancy even occurring. So this is good news for us in this environment, especially those of us who are already married to those AS people who are already married and have sickle cell children. You know what that means. It's emotionally, financially, and psychologically draining to raise a sickle cell child. So this is a very beautiful news. Even now, if they've had an AS child, a sickle cell child already, you can plan for the next child or the next children and make sure they are free from sickle cell disease. So how do you do that? How is that possible? What we just simply do is to check. As soon as we fertilize the babies in the laboratory, we check the DNA. We take a cell and check for then that will enable us to know the genotype of that child. So what other diseases do we have that pre-implantation genetic diagnosis can take care of? We have the X-linked disorder, which a woman carries. A woman is a carrier, but it manifests in a male child. So like hemophilia, in this condition, you have the woman being a carrier, but only in male children does it manifest. So how does this now affect, how does PGD help in this? First of all, we know that, hemophilia is an X-linked disorder, which is manifested in the male child. So first of all, you can either screen out the embryos with the carrying this X-linked disorder, which is the male embryos carrying X-linked disorder, or the woman can decide to have only female children. So you see that PGD can help very well in X-linked disorder. So what in this our environment, we know what it means to have a male child, especially in this part of the world, in Nigeria specifically. Most homes, they keep trying and trying and trying. You see a woman who has up to 6, 7, 8 girls just because she's looking for a male child. We know it because of our culture and our values. So what does PGD do in this kind of situation? A woman who has been trying, having successive female children, can opt for PGD, meaning that she can as well do an IVF program. We generate the embryos and check the embryos for their sex before we put it in the woman, meaning that you get to know the sex of a child before pregnancy even occurs. So it's very, very important. But you know, with PGD, you have to do it alongside with in vitro fertilization. So I'll have to just talk about in vitro fertilization at the end of the day. So what is IVF? IVF simply means we grow the eggs of a woman. Having grown the eggs of a woman, we bring it out, we fertilize it with the male gametes in the laboratory, and transfer this baby back to the woman. But when we have to do PGD before transfer, what we'll do in that case is that we then take, because the embryo has to grow for at least 5 days in the laboratory. So we take a sample of the embryo. We take a cell, because the human life, we know, some of us that did biology know that cell is the smallest unit of life. So we take a cell from this embryo and check for the sex of the baby. So if we have up to 5 embryos, we check for the sex of all 5 and transfer the desired sex. And this helps in family balancing. So even if it is a male child she wants, she can be able to transfer just the male child to the woman. If it's a female child she wants, you can transfer only the female child to the woman. So this is 100% certain of having your desired sex. And this helps in family balancing and emotional fulfillment, and helps to keep a home happy. So PGD is very, very important in our environment. So that's PGD. And some people may be like, okay, if you take a cell from this baby, are you not going to have a deformed baby at the end of the day? My answer to that is no. Because at that point in life, by the time the babies that's embryos now, when they are just about 2 days old in the laboratory, if you take a cell from the child, from the embryo, it means nothing, because all the cells, they have the capacity to become any part of the body. So we call it totipotential. They have totipotential quality, meaning that any cell can become anything. So taking one cell out of the embryo is not going to damage the baby as a child, when the child comes out. So there's so many studies that have been carried out, but that shows that PGD will not deform the embryo. So for today, we have talked about pre-implantation genetic diagnosis, the advantages and the beauty of it. We talked about IVF and how you need to do PGD alongside with IVF, and the importance in family balancing to screen out some certain diseases in a newborn, in a child. So having talked about that today, I'm sure we have educated our viewers out there about the importance of pre-implantation genetic diagnosis. Thank you very much, and God bless you for listening.
Since there are 2 tubes, if a woman has one of the tubes blocked, then there's a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered.
Many women go from one hospital to the other, trying to cure what is not actually a disease.
It can be pretty annoying when I have to deal with oil and grease in the kitchen, stains in the toilet, dust in my car and office. But the new Fresher Wonder Wipe multi-purpose towel, all of that is in the past. Now, my kitchen utensils are oil and grease free. My toilet is sparkling clean. My car and office, wow. And guess what? I don't have to worry about any other paper wipe and the stains on them. Fresher Wonder Wipe multi-purpose towel is first of its kind. It can be used anywhere and everywhere. It is strong, absorbent, hygienic, and it saves cost because it is washable and reusable. It comes in a normal and heavy-duty sheet for stain removal. Fresher Wonder Wipes multi-purpose towel is available in all leading stores in Nigeria. A quality product from the House of Daraju.
Memories are created daily from events, photo and video shoots. Having the perfect studio, equipment and right team is everything. That's why I completely trust Arwell's Media with my event coverage, studio space, equipment, photo and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. Orwell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Acme Road, Agidingbi, Ikeja, Lagos. Orwell's Media, solving problems, executing visions, and giving value.
Carrots are rich in beta-carotene, which is a powerful antioxidant which helps in maintaining a healthy skin. It aids digestion by increasing saliva and supplying the essential minerals, vitamins, and enzymes necessary for it. And it helps in preventing gastric ulcer and also has an anti-cancer benefits. Did you know consuming carrots regularly are known to improve the quality of breast milk in mothers? It also helps in increasing the menstrual flow, and it can also be used as a home remedy for treating worms in children.
Hello, this is Health Tips. My name is Jibe Ologe, and today we're looking at when not to use ginger. Never use ginger if you have any of these conditions. It can cause serious health problems. Ginger is one of the healthiest plants in the world. Science has been able to confirm its usefulness and presence of numerous beneficial substances. It contains rare bioactive compounds which can improve your overall health and provide your body with all the essential nutrients it requires on a daily basis. The root is usually used as a spice in different dishes, but it is also a powerful natural remedy that can treat and prevent numerous diseases and conditions. Ginger is especially effective against digestive problems, thanks to the presence of special enzymes that can improve the presence of digestion. However, despite its benefits, ginger can harm your health if combined with certain medications or if you're suffering from certain conditions. Here are the group of people who should avoid ginger. Blood disorders. Ginger can boost your blood flow and stimulate circulation, which makes it a great remedy against diabetes, obesity, Raynaud's disease, and peripheral artery disease. Patients suffering from hemophilia, however, should avoid it. Hemophilia is a genetic disorder which reduces the blood's ability to clot, meaning that even a small injury can cause heavy bleeding and may be fatal. According to experts, ginger can also aggravate your condition and cause a deadly hemorrhage, which is why you should avoid it if you're suffering from the disorder. Ginger and medications. People who are on high blood pressure or diabetes medication should avoid ginger. It can actually interfere with your medications. Furthermore, ginger should be avoided if you're on anticoagulants, beta blockers, or insulin shots. Ginger thins the blood and reduces blood pressure, which will effectively reduce the effects of these drugs. Be cautious with these combinations. Taking ginger with medication that can also slow clotting might increase the chances of bruising and bleeding. Warfarin is used to slow blood clotting. Okay, so for people who are underweight, if you need to gain weight for medical reasons, you should avoid ginger and ginger supplements, as it is rich in fiber, which improves digestion and regulates the pH level of the stomach. The result is burning more fat, which is the opposite of what you're trying to achieve. Women that are pregnant. Ginger contains special compound that can strengthen your muscles and improve your digestion, but pregnant women should avoid it as it might induce premature contractions and preterm labor. Experts warn that the root should especially be avoided in the last trimester as it obstructs the absorption of iron and vitamins in the body. Some experts say that pregnant women can consume ginger against morning sickness. However, we suggest consulting with your doctor first. Okay, now ginger substitutes. If you want, you can easily substitute with the following: try sweet peppers, cayenne pepper, or red paprika. Milka Rasovic, the world's famous nutrition, according to the experts, they claim that peppers have a similar effect on the body. So if you eat spicy foods, you can take red paprika, okay? So if you don't, consume sweet peppers. Paprika contains high amounts of iron, vitamins A, B6, and E. Paprika sure has a lot to offer. Also, paprika is capsaicin, an anti-inflammatory agent known for healing the digestive system. We suggest these spices to a glass of lemonade, drinking the mixture every morning for better results. You may also try cardamom with its rich savory flavor, nutrition, and supportive effects. Cardamom neutralizes acid, aids digestion, and tastes great in coffee. Okay, so please, if you have these conditions, stay away from ginger. Okay, thanks for listening to Health Tips. My name is Jibe Ologe, and I'll be back again with more health tips.
It's Health Monitor, the #1 health show.
Welcome, viewers. Today we'll be talking about chronic glaucoma. Globally, glaucoma is one of the leading causes of visual impairment. It is commonly called the silent thief of sight. There are various types of glaucoma, but primary open-angle glaucoma, which is also known as chronic glaucoma, is the most common. It has no symptoms in the early stages, but slowly and painlessly destroys your vision if it's not detected and treated. Unfortunately, loss of vision as a result of glaucoma damage cannot be reversed. It mainly affects the middle-aged and the elderly, although it can develop in younger people. The earlier glaucoma is detected, the more successful the treatment. Even if you seem to have excellent sight, this actually does not rule out glaucoma, because glaucoma initially destroys the off-center vision, leaving the central detailed vision unaffected until a later stage. Then blank patches in the field of vision may it might actually go unnoticed as the less affected eye completes the picture. Glaucoma does not affect the ability of the eye to focus, and the condition may be present even though vision seems fine without the need for glasses. Glaucoma is dangerous because you could lose a considerable amount of sight even before you are aware of the problem. There are risk factors for developing glaucoma, and these include high intraocular pressure, high myopia, positive family history, thin central corneal thickness, increase in age, to mention just a few. The only way you can know for certain whether or not you have glaucoma is to arrange for a comprehensive eye examination. Treatment for chronic glaucoma is usually with eye drops. Laser treatment or surgery may be necessary in some cases. The good news is that once it's detected and treated, most people retain useful vision for a lifetime. If left untreated, glaucoma may lead to what is called tunnel vision and eventually to blindness. It is estimated that approximately 2% of people over the age of 40 would have glaucoma. So be aware that the likelihood of developing glaucoma and other eye diseases increases with age. So regular eye tests are essential to ensure early diagnosis and optimum eye health. Thank you.
Memories are created daily from events, photo, and video shoots. Having the perfect studio, equipment, and right team is everything. That's why I completely trust Arwell's Media with my event coverage, studio space, equipment, photo and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. Arwell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Acme Road, Agidingbi, Ikeja, Lagos. Arwell's Media, solving problems, executing visions, and giving value.
Ways to lower cholesterol, reduce saturated fat, foods like red meat and dairy foods. Use fresh garlic regularly in your meals. Garlic has been shown to help lower cholesterol level. Drink green tea daily. The antioxidant in green tea helps lower cholesterol. Eat plenty of soluble fiber. It has a powerful cholesterol lowering effect. The best source are beans, apples, citrus foods, oats, carrots, peels, and so on.
Thank you so much for watching the show, and I want to say thank you to all the other experts who were on Health Monitor today. All right, and viewers, thank you for watching. Keep the emails coming in and check us on Health Monitor _ and leave your comments. Okay, thank you for being there. Health Monitor will definitely return next week.